Good morning, everyone. I am delighted to see everyone here today on the beautiful campus of Kean University and to welcome the governor of our great state, Governor Phil Murphy. This morning, Governor Murphy toured the Union County COVID-19 vaccination site here at Kean, where more than 50,000 area residents have already received their vaccination. The governor witnessed firsthand the great things that higher education and county government can achieve together when they partner on projects that serve our community, our students, our constituents, and where they partner on projects that saves lives. Our successful COVID testing, processing, and vaccination efforts are the direct results of strong leadership demonstrated by Union County and the President's Office of Kean. They are also the results of the powerful leadership that Governor Murphy has shown since the pandemic began more than a year ago. I was there at the beginning with Governor Murphy. I witnessed firsthand his strength, his tough decision-making, and witnessed firsthand his decisiveness when complex strategies had to be put in place. Let me tell you, I watched, I listened, and I learned a lot about leadership from our governor. Now, we've reached the vaccination stage of this pandemic, and I continue to be proud of his leadership. It has never wavered. Today, we are heading towards normalcy in New Jersey, and we have Governor Murphy to thank. So it is truly my pleasure to introduce him. Ladies and gentlemen, please join me in welcoming New Jersey Governor Philip Murphy.
Thanks, buddy. Love you, pal.
Always, man.
Thank you,
Always,
man.
brother.
Thank you. Thank you, Lamont. I haven't said this in a while since you've come over to this position. You're doing a great job here, by the way. More on that in a second. People ask me, when did we get our act together on the education front? This is a line I've not used in a while, and I used to say, when the big man joined the band. Hearkening back to Bruce and Clarence, thank you, Mr. President, for welcoming us and for opening Kean's campus to our vaccine efforts. You all have done an extraordinary job. This university is a New Jersey gem in many respects, but I will say in particular for healthcare workers and educators. It has been a game changer in countless thousands of careers over many, many years, and so I'm honored to be here. We also have a cavalcade of important people with us today, and I want to take a minute and acknowledge them. And if I miss anybody, the guy who follows me will pick up behind me, and I want to start with him, a guy I've known a long time, back to when I was at the Democratic National Committee, an outstanding leader, and a dear friend, State Senator Joe Cryan. Joe, bless you. We have your legislative partners. We have Annette Quijano and Jamel Holly with us, Assemblywoman and Assemblyman. Great to have you both. We not only have the mayor of Union, Michelle Dellisfort, who we were together, I think, 2 weeks ago today, talking about the American Rescue Plan, which is a game changer for our state. But as Elizabeth Mayor Chris Bolwich reminds me, at least 2 acres of this campus are in Elizabeth, New Jersey. Let's hear it as well for Chris Bolwich. You don't get done in New Jersey without people in Washington laying it out and fighting for every bit of resources that we need in this state, and there's no one better than this. Please help me welcome Congressman Tom Malinowski. Bless you. I want to give a shout out to the county commissioners. Angela, again, you get the assist, the big assist on this one. Commission Chair Al Mirabella, Vice Chair Rebecca Williams. Rebecca, I didn't notice the crutches when I saw you inside. You okay? Okay, great to see you. We also have Commissioners Gerritsen, Granados, Staten, and Hudak are with us. Please join me in giving them a shout out. I could go on. Jessica Cohen, where's Jessica? Jessica gave us the tour. She's running the show here. Really impressive. To you and your colleagues, healthcare workers, volunteers, law enforcement, to each and every one of you, a shout out from each of us to each of you. And with us, not one, not two, but 3 cabinet members, starting with the woman who needs no introduction, the Commissioner of Health, Judy Persicelli. I said, Judy, you're not on the speaking program today. And she said, thank God. I was afraid I was going to be offending her. Please help We welcome, in addition to Judy, the Commissioner of the Department of Children and Families, Christine Norbert Beyer. Christine. And our acting Human Services Commissioner doing a great job, Sarah Edelman. Sarah, great to have you. So we all just had the opportunity, and some of you were with us, to look on as some of our child care educators and staff received their vaccinations. Ensuring access to child care is a cornerstone of our economic recovery. These providers have been on the front lines all year supporting families and our workforce as a whole. And they are among literally tens of thousands of others across our state rolling up their sleeves today. This is real and unmistakable progress, but we are on a journey. We are not there yet. Let there be no doubt about it. Chris and I were talking about the need to get deeper into communities like Elizabeth, and I'm certain like Union as well. We are already averaging several 100,000 shots a week, and starting next week, we're going to see an increase in our federal allocation, which will allow us to get even more shots into arms. As was noted by Judy on Wednesday, next week we're receiving 494,430 total doses. That's a nearly 20% increase week over week, and this is in the ballpark now of what we were expecting, and I think it only goes up from there. So this morning, as of this morning, so far, we have put 3,798,523 doses into the arms of New Jerseyans. 2,515,767 New Jerseyans have received at least one dose, and 1,357,829 New Jerseyans are now fully vaccinated. Either they've gotten their second dose or they've gotten the one J&J dose. And by the way, this is the bad news. We need every single one of those doses because today we're reporting another 5,884 additional positive, both PCR and antigen test results. The positivity rate for the PCR tests recorded on Monday, and there were 4,339 of them, was 8.06. As we predict, when you get out of Saturday and Sunday and you get to weekdays, it gets down into single digits. But Judy and any expert, and certainly myself, would not suggest that 8.06 is a level that we're comfortable with. It's better than the weekend, but not acceptable. Rate of transmission currently 1.1. As of last night, our hospitals were treating 2,174 patients, 438 of whom were in intensive care, and 220 of whom were on a ventilator. Throughout the day yesterday, 314 new COVID patients were admitted to our hospitals, while 272 live patients were discharged, and our hospitals reported, these are not yet confirmed, 31 losses of life in the past 24 hours. And sadly, with the heaviest hearts, I must report another 28 confirmed COVID-19 deaths. That total now stands at an unfathomable 21,823, with an additional 2,535 probable deaths. Takes your breath away. So with all of this as backdrop, I will make a couple of announcements today on Judy's and my behalf. First, I am proud to announce that through our work with the Biden administration, FEMA will be setting up a federally run pilot community vaccination center at the New Jersey Institute of Technology in Newark beginning Monday morning. This site will be staffed and stocked to administer, when it's fully up and running, 6,000 doses a day, 7 days a week, and will focus on ensuring vaccine equity and reaching deep into communities with higher risks of virus exposure and infection. These 42,000 weekly doses will be above and beyond our state allocation. We will have more information forthcoming on this partnership. Again, it begins on Monday. It will ramp up, not on Monday, but over the next number of days to 6,000 a day, and it will be in place for at least 8 weeks. More details to come. So given this news, the fact that we are on course for more vaccine doses, and our knowledge that the vaccination infrastructure we have built is ready, today I am also proud to announce the next expansion of vaccine eligibility, which will take place beginning on Monday, April 5th. Remember, there's a whole group of folks who are going to be eligible this coming Monday, March 29th, including essential retail workers, longshoremen and women, and other groups. But as of April 5th, so a week from Monday, all New Jerseyans age 55 and over will be eligible for vaccination. That includes, by the way, my wife and me. And I'm going to make my vaccine appointment, as will she, through the same process that millions of New Jerseyans have done for theirs. All individuals with intellectual and developmental disabilities will also be made eligible. Through a partnership between the Departments of Health and Human Services, we have vaccinated residents and staff at our state developmental centers and group homes. This expansion on April 5th will bring all individuals, regardless of where they reside, with intellectual or developmental disabilities, age 16 and over, they will be eligible. Additionally, we will be moving to the next tier of essential workers based on their employment sector. As we're at Kean University, I should start by saying we will announce that this expansion will include all educators and staff at our institutions of higher education. This expansion will also cover all librarians and staff at municipal and county and state libraries. Also included in this April 5th expansion are workers in the retail financial sector, and we know this is important for all customer-facing workers especially. The same will go for workers at laundromats and dry cleaning businesses. We will also open eligibility for all in the building and home services industries, including construction workers, code officials, plumbers, electricians, HVAC technicians, and property management and maintenance workers. Those who work in communication infrastructure and IT, in the public utility sector, and all sanitation workers will also be made eligible. And to our friends in the media, you will be included in this expansion for April 5th, regardless of the tough questions you ask me. Although I should hold that out here until the end of this press availability. Many of you have been right there on the front lines with those fighting this pandemic and speaking with the New Jerseyans who have been most impacted, and you have kept your communities informed, and we thank you for that. We know that there are many in these categories, by the way, who have already received their vaccinations because they already qualify under a previous eligibility expansion. But we're now ready to push forward to include everyone on this list. Judy would want me to remind folks that since January, anybody, regardless of your age, with a chronic condition has been eligible to get an appointment and get a vaccination. So if you're fighting cancer, diabetes, heart disease, obesity, you've got some respiratory issue, even induced by smoking, you have been eligible since January. Please keep that in the back of your mind. Through this expansion, as well as the increase in doses and the opening of the community vaccination site at NJIT, we can set May 1st as our target date for opening eligibility for everyone in the state of New Jersey, age 16 and older, who lives, works, or studies in this state. We want everyone to have a date they can look forward to, and I know everyone is anxious to get their shot. We set an initial goal, Judy's been very clear about this, of vaccinating 4.7 million New Jersey adults. We will not only get there, but I know we can exceed that goal together. And I think this needs to be said. If you look at efficiency of delivering doses into people's arms relative to the supply received, New Jersey ranks number 4 in the nation right now. And the 3 states ahead of it, Minnesota, North Dakota, and New Mexico, I believe combined don't have nearly the 9 million residents that we do in New Jersey. This hasn't been a straight line, and for folks out there who are still trying to get an appointment and you're anxious, we don't blame you. We understand that. There is still a supply-demand imbalance, but that is going to go away. Number one. Number 2, equity remains our principal and main focus. We have got to get these shots into the arms of everybody in our state, not just some. We have the most diverse state in the nation. It is incumbent upon us, working with county and local officials, health departments up and down the state, to get vaccinations in to the broad diversity and broad representation of this state. And I not only want to say that in words, we promise you that will happen, and it will happen soon. With that, again, thank you so much for having me. Please help me welcome a great friend and a great leader, Senator Joe Cryan.
Thank you, Governor. Morning, everybody. It's an exciting day. I'd like everybody to just take a moment. 3.8 million, essentially, New Jerseyans have had the vaccine here on March 26th. If I told you on January 1st that we would stand here today with those kind of numbers, you would have laughed. You would have said it's not possible. You would have said there's absolutely no way that we in New Jersey could look forward and have the optimism that we have today with the idea that May 1st, literally everyone will be eligible. And Governor Murphy, I want to thank you for your leadership on that. You deserve a round of applause. Congratulations, Governor. Let's keep it going. Thank you. Judy, to the commissioners, thank you for your leadership, your undeniable leadership in this. Yes, there's work to be done, but there's an optimism that I don't think has been in the air here in New Jersey for a long time as we look forward to the recovery with those of us that can get vaccinated to have that opportunity to do so. And you know, Governor, we can do that because of the site that's here and so many like them. And I want to tell you that it's a new day here at Kean University. These black fence that you see outside, I think, used to be an artificial border. Today, it's an opening, welcoming sign of what can happen with new leadership and a new vision. And let me just give you an example. This site, with the cooperation of the great commissioners, freeholders, whatever the right term is these days, used to be now, and the partnership with Union County, with people like Ed Oatman and Jess Cohen, outside has been a testing site for an awful long time. And it seems like it's a long time ago, but it wasn't, when we all fought about, can you get a test? Or clicked on site, right, Judy? Where's my results? Can I get them? Folks, that was only a few months ago. Let's take a moment and understand where we're at today. The sites like that outside with the swabs and all the things that went with it, and yes, we still need testing. It's still important. But today we have optimism for the future because of sites like this at Kean, where we went from testing, and we still do, to the impressive facility that we saw inside that holds the hopes and dreams of so many. And I can assure you of this, having spoken to a whole lot of folks, Governor, there is no better feeling and no more optimism than that individual that says, I just got my second dose. I just got my J&J. They'd pass up a winning lottery ticket for it because they know what it means for their friends, for their family, for their loved ones, and for themselves. Today, we share a common goal with optimism for the future. I want to take a moment, Governor, and just thank a couple folks like you. I need to thank my Congressman, Tom Malinowski. Tom, the battle for FEMA, the battle for the vaccines, he answers the phone like Don Payne, like Albio Sears. He answers the phone and hears us. Because as Chris Bowledge and Michelle Dellisfort will tell you, yes, we're optimistic about a FEMA site, but we'd love more vaccines to be local. Have you heard us say that, Governor? Once, twice, first time he's ever heard it in the last 10 minutes. All right? But we do fight for that, and the reason for that is simple. We want more people to be vaccinated. 3.8, unimaginable, but today now, with the optimism of next week's opportunity for expanded classes and for May 1st for eligibility for all and vaccines for all, we want everyone. And if you don't hear my voice, please hear it loud and clear. Sign up and get a vaccine. It's how we get through this crisis together. And with the variants that I know you'll talk about a little more and the concern that it is, it's even more important that you get this vaccine. But Governor, if I can, I just want to switch back to this site for a moment because Lamont's a little, Dr. Repollet is a little shy, but this site has been a beacon of hope for so many in Union County. The cooperative effort of the commissioners and the Union County leadership, as I mentioned, Ed Oatman, Jess Cohen, and so many others. When you come here each day, you see people like Vicki Drake. I want to take a moment and just recognize 3 volunteers, if that's okay. Because most of these sites around the state, and this one here at Kean, frankly, with the environment that the president fosters, has been welcoming for people who want to participate. And there are 3 of them, I believe they're all back there. If they're not, because we didn't plan this, but I'd love them to raise their hands, if they don't mind. One is a pharmacist who has been here since at least last March on a volunteer basis. And now he's the head pharmacist here, I believe. Is that right, Ed, the way we call it? But ladies and gentlemen, think about that. Since last March, here on March 26th, but a year ago, decided to take the time, commit his professionalism and his discipline to helping others. It's all of what New Jersey can be about, and I'd like you to recognize Ed Rucky over there. Ed, thank you for your work. The next guy's a little shy. He actually administered, I believe, the vaccine today to some folks, and you may have gotten a shot of him doing so. He is the jack of all trades here. He was here for the testing, helped us set it up, right, Ernie? Helped organize it, helped do all the work with that. Today, he helps administer vaccines and make sure that this site is productive as can be. Ernie Hernandez. Ernie, thank you for all your work. And finally, because we look at volunteers and sometimes we ask, do the young people get involved enough? Or are they part of the process and the solution? I'll tell you how welcoming Dr. Repollet is. Because the next lady I'm about to introduce to you is a Rutgers student. who's been on campus here each and every day, I believe since November. She does an incredible work with the emergency work, and I'd like to recognize Janet Silva right over there. Janet, say hello. Juliana does incredible work, and I didn't say it loud enough, and I want to. Juliana Silva. Juliana, thank you for everything you do. And by the way, keep an eye on Rutgers next year at the NCAA tournament as well. All right. With that said, we want to take a moment and just understand the collaborative nature of the success of this site and the collaborative nature of what we've done together, frankly led by our great governor, to get 3.8 million vaccines into people's arms. A task that, when you take a moment to reflect, simply was thought could not be done. Today, we don't celebrate it. We look at it as another of the milestones to be challenged upon, and to finally get to full vaccination, to herd immunity, and to the safety and to the citizens of this state, that we can move forward. As the weather turns warmer, what I say to folks now, and Congressman Malinowski and I discuss it, there's an optimism in the air. There's an optimism in the air due to great leadership, due to great collaborative efforts, due to outstanding volunteers, and hopefully due to each and every New Jerseyan signing up and getting the vaccine, that we all have the optimism of a great second half of 2021 and for the years forward. Thank you, everyone. Thanks. Thanks.
Really well said.
Thanks.
Thanks, man. Let's hear it again. Senator Joe Cryan. We'll take a couple of questions. Before we do, just want to reiterate really 2 points. Joe mentioned the variants. They're all over our state. We know that. We've been assuming that since, I think, January, if not before. And that's why you see cases as high as they are, our numbers going a little bit sideways. I know Judy and her team take these with deadly seriousness. The important point as well is to make the evidence continues to be that the 3 vaccines are 100% effective against severe illness and fatality. So that continues to be the case. And the basic stuff is still the stuff that works, even against the variants. Face coverings, 2 preferably. Social distancing as we are today. Wash your hands with soap and water. Take yourself off the field if you've been exposed or you don't feel well. And then at the right point, get tested. Second point, this is not just as it relates to the battle against COVID, but more broadly. Union County is a heartbeat county of this state. In so many respects, as it goes, we as a state goes. With some extraordinary communities, Union, Elizabeth, and many others. It is among the most diverse counties, never mind in our state, in the United States of America. And you all wear that diversity, as we do in New Jersey, as a badge of honor. And as it goes, as I say, in so many respects, the state of New Jersey goes. Before I forget, to our Jewish brothers and sisters, Passover is upon us. We wish you a holy, healthy, and Judy would want me to say, responsible Passover. Please do the right things. I always get this butchered because I'm not good at the pronunciations, but Hag Pesach Sameach. With that, a couple of questions, please. Listen, there's a lot of reasons, but let me tell you, we just didn't announce this FEMA site by accident. It's in Newark. And while it isn't per se only for folks who live in Newark, we're working with the mayor and the local community to make sure the word gets out. Listen, equity continues to be a huge challenge for us. Partly it's because the 2-dose vaccines, which hit us first, are really hard to manage and execute on. You have to, they're cold chain storage, either minus 20 degrees Celsius or minus 70, 21 or 28 days until your second shot. That's really hard. The J&J vaccine, and by the way, we haven't had enough doses from the feds. That's beginning to change, and the J&J vaccine is a game changer. Now, we've had probably of the 3.7 or 8 million doses that are in arms, I'll bet you 100,000, maybe a little bit more, Judy, or J&J, maybe 100, 150,000. That number is going to go up dramatically. And with that, we will get right at the equity. One other point, and we're obsessed with that. And we're obsessed that changes very soon, i.e. in the next, by the end of April. You may ask, and if you don't, I'll give you the answer in any event. You sign up. Your eligibility means you sign up the way anyone else has been signing up. And for this FEMA site, it's the same stuff. The website, covid19.nj.gov/vaccine. The phone number is 855-568-0545. Operators have now made tens of thousands of appointments. They'll continue to do so. Anybody else? So, please. On the first point, I don't have a specific number. We did give a number at our press conference on Wednesday. Do you have any, Judy, teachers or child care workers? Yep. At least for the first shot, right? And we could come back to you. Alex, will you help me come back, or Dan? Listen, we have to do what the feds tell us to do. We've requested a waiver not once but twice. We think that's the right thing to do. I haven't asked you, but I assume you would agree with that. When you measure kids' progress, you've got to measure it in some context, and we've had a hard time with the context. Having said that, I don't want to preempt what the feds are going to say or what we'll do in response, but we'll do at the end of the day. So United States of America will do what we're told. Thank you all so much. Please, yeah, one more. Yes. I love the NBC hat.
Thank you so much. I have a collection, as you know, right?
I do know.
When you talk about equity, one of the toughest challenges is particularly in urban communities has been getting people who may not have transportation, whose hours are different to these vaccination sites. Do you support these mobile clinics? And are there any resources that the state?
Yeah. Not only do we support them, but we're sponsoring them. Do you want to just come up and make a quick comment, Judy? The woman who needs no introduction, Judy Persicelli.
Thank you. A couple of things. We've learned that bringing vaccine clinics deep into the communities and community centers and churches, the percent of individuals from Black and brown communities increases exponentially. In Elizabeth, Trenton, we're seeing between 45 and 60% of individuals getting vaccinated from communities of color. We have delivered triplets. They just arrived. 3 vans that will be outfitted with a full staff to go deep into communities and vaccinate individuals in about 3 weeks. So we're working with one of the major healthcare systems in New Jersey to license those vans as acute care centers, and we'll be ready to move with our triplets. So look forward to big blue vans going into the communities. We're going to put one out quickly for testing so people get used to seeing the vans. And I've been about 3 weeks.
I love it.
The triplets will be
All
out.
right, love that. Thank you for that. Judy, thanks for everything. So, Joe Cryan, bless you and thank you. Lamont Repollet, I miss you. You're doing great work. Congressman Tom Malinowski, thank you for everything. Annette Jamel, to the county commissioners, Mayor Dellisfort, Mayor Bolwage, to all the other healthcare workers, volunteers, law enforcement officers, thank you so much for hosting us so graciously. God bless you all. Happy Passover to our Jewish brothers and sisters. Stay safe. Keep doing the basics. Get vaccinated. We're pulling out of this.